Hello, my name is Bob Sherrar. I am a physician and epidemiologist who has spent a lifetime working on public health issues. I am the current chair of the section on public health and preventive medicine for the College of Physicians of Philadelphia. I would like to welcome you to this webinar series on climate change and health in Philadelphia. I would also like to thank Dr. Marilyn Howarth and the members of the academic public health programs who put this wonderful series of presentations together. Climate change is one of the most important public health issues facing our worldwide community. This webinar series was put together because the public health community must know and understand the huge impact that climate change will have on human societies throughout the world. And we must work together to lessen its impact. Now, Philadelphia is blessed with a wealth of public health talent. There are 8 schools in the Philadelphia metropolitan area that offer training in public health and hundreds of students working on various public health degrees. The purpose of the section on public health and preventive medicine is to bring this vast public health community together to address issues facing our communities. Any person interested in public health may join the section, where they can network with the public health leaders of our community. You do not have to be a member of the College of Physicians. Student memberships are free. To learn more about the section, go to the college's website and read about the various activities that we sponsor. Now, sit back and relax and learn from these wonderful webinars. Thank you.
Hi there, my name is Reema Clem. I'm currently the chair of the Department of Public Health at Arcadia University, located in Glenside, Pennsylvania. Our department is pleased to be part of this important effort to mitigate the local impacts of climate change in the Philadelphia area. In this talk, we'll focus on using a community-engaged approach to extreme weather or disaster preparedness at the local level. This talk addresses the CEF, Council on Education for Public Health, MPH competencies listed here. ASPPH competencies are listed in a separate document. Climate change has numerous impacts on human health. In this talk, we'll focus on the impacts of extreme weather. Events such as heat, cold, and storm activity not only pose a direct threat to human health, such as injuries and illness, extreme weather also exacerbates existing health conditions like cardiovascular and respiratory diseases. Climate change adaptation refers to actions that help to reduce vulnerability to the current or expected impacts of climate change, like extreme weather and related hazards. Developing and implementing adaptation efforts that build our resilience to climate change are increasingly important. These strategies include building climate resilience public health infrastructure like emergency preparedness and response, increasing access to centers for refuge, and building strong communities. Many adaptation measures need to happen at the local level to reduce health risks. Taking a community-engaged planning approach can promote resilience in every community. A community-engaged approach involves working collaboratively through a bidirectional relationship between local partners, such as community members, and public health practitioners that results in informed decision-making to promote the well-being of those in the community. Engaging and involving affected community members in adaptation efforts in climate research is crucial for developing adaptation approaches that are inclusive and informed by lived and local experiences. Today, we're fortunate to hear from 3 speakers who will help us to understand community-engaged preparedness efforts related to extreme weather at the county level. First, I'd like to welcome Dr. Suzanne Redington. Dr. Redington is the director of the MPH program in the Department of Public Health and the Public Health Officer at Arcadia. Dr. Redington has expertise in emergency preparedness and health communication. I'd also like to welcome Fallon Maggio. Fallon is the Public Health Preparedness Coordinator at the Bucks County Department of Health. Fallon has nearly 2 decades of experience in public health emergency preparedness and volunteer management, both at the municipal and county levels. Dr. Redington will start us off by giving us an overview of planning for extreme weather.
Thank you for that introduction, Dr. Clem. And so, yes, I am going to talk a bit about how we plan for extreme weather and what that means at the more local kind of community level. And so first I wanted to start off with, we're making these connections between what our severe weather is like and what we expect it to be like as we see our climate continuing to change. Climate change has impacted severe weather in a number of ways. Some of which include the increased frequency, the increased intensity and duration of these extreme weather events in many of the land regions across the globe. Some examples of what that looks like include things like having higher average temperatures, having more frequent heat waves with longer heat wave seasons. We see it impacting the total annual precipitation, as well as having higher percentages of these really intense single day precipitation events like severe storms. And we see the weather patterns shifting as well, so that some areas may be experiencing these greater levels of precipitation and severe weather, and some areas may actually see less precipitation. So the weather patterns are shifting. These are just some examples of how climate change is impacting severe weather, and you can always seek to learn more, but hopefully that gives you a good sense as to what it looks like currently. And so then what does that mean for what severe weather looks like in the US and what kind of severe weather disasters are most common? So this depiction, this visualization comes from FEMA, the Federal Emergency Management Agency. It was current as of May in 2023. So you can see that the weather disasters that are most common in the US to that date have been things like wildfires and severe storms. But it's important to recognize that what's most common for the US as a whole doesn't see it play out that same way in as we get to the more local jurisdictions. So you can see some areas of the country, fire is one of the most prevalent severe weather disasters, and other areas might experience severe storms or flooding as the ones that are most prevalent in those jurisdictions, where we can see what severe weather is most prevalent in Bucks County. So the data that we see here in the chart is from 1996 to 2024. And we can see that severe weather and stuff that includes predominantly rain as the primary form of precipitation is what is most common in Bucks County. And heavily connected to that is the rate that we see of flooding and flash flooding. So those two things are really very common in Bucks County over the last couple of decades. And you can see that represented as well as to what Bucks County plans for. So every county has a hazard mitigation plan, and they make those things publicly available if you ever wanted to look it up for whatever county you might live in. The ones that Bucks County plans for, listed on the left of this slide, are ones that were determined to be things that we're most at risk for in Bucks County, which is, again, if I didn't mention, just outside of Philadelphia, right? And so we look at historical data, we look at our geographic region, a whole bunch of other data to figure out what are we most at risk for and what should we plan for. And you can see those same things kind of represented in that space as well. So we know what kinds of weather we're most at risk for in Bucks County, but has it changed over time? And we can see that on the next slide, where if we take all of the severe weather events that were reported in Bucks County over that same time period, we can see that in general, those reports have increased, those occurrences have increased over time. And that connects back to what we're seeing with climate change, right? Climate change is impacting the frequency, the duration, the intensity of these weather events. And we see that represented in this Bucks County data as well. So what does that mean? And how can we also further identify that things are changing? And when we go to the next slide, another thing that we can look at to further understand if severe weather events and disasters are changing over time and increasing in frequency is by looking at things like disaster declarations. So disaster declarations is this kind of legislative response, this policy kind of response to help us provide funding and resources and other kinds of support to local and state jurisdictions when there is a disaster. And they help us with those response and recovery efforts. We can look at how they change over time. And there's a couple of different types that we look at as well. The ones that we're most concerned with for this kind of discussion are emergency declarations, major disaster declarations, and fire management assistant declarations. All of those connect with responding to severe weather of various kinds. And they either give us resources ahead of the disaster occurring or help us during and after the disaster. Most of them can be declared at the state and national level, but still support local efforts. So what does that mean and how has it changed over time? We can see on the next slide that the number of disaster declarations has increased since we started tracking these, right? So we started tracking the very first kind, the major disaster declarations, all the way back in 1953, and we added in the other three really over time. In this data, we don't see data represented for public health emergency declarations, just to make sure that's clear, but I wanted you to get a sense as to when we first had those available. So what does it mean that we see disaster declarations increasing over time? It means that we have more events that require additional assistance beyond what the local jurisdiction has available to respond to whatever that severe weather event was that happened. And that means that they're happening more, but we also have more stuff and more people that are at risk, which means we need more resources to respond to these things. So as the weather changes and weather is more severe, we also have to understand that more people and more things are at risk at that same time. And so we've seen the weather changing over time. We see these declarations increasing over time. So if we go to the next slide, it brings up the question, okay, great, right? Like things are getting worse. So what do we do about it? And one of the things that government agencies, emergency management, public health that we do is we take this kind of all hazards approach to planning for disasters, including those of extreme weather, but not specifically focusing on those, right? We take this approach where we plan for emergencies and disasters as if it could be applied to any type of event, right? And so we have this core response management system that can be applied to a wide variety of different scenarios. And then we figure out how could things be really different in each different scenario so that we have these little annexes that we can add in to help specify our all hazards planning to a particular type of disaster. But what this approach gives us is this really good general foundation that can be applied to any disaster response that helps to not only increase continuity between jurisdictions. So when we have to respond to things together, because severe weather doesn't adhere to political jurisdictional boundaries, right? But it also helps reduce confusion amongst our responders and our response agencies, because then we know that this base plan, if you will, is what we apply to any disaster scenario. And then we just have to learn the specifics for whatever that event was. It also is a little more efficient and a little less expensive to do this type of approach, which is inherently useful to conserving our resources as well. This type of planning occurs from the local to the national level. And on the next slide, you can see some of the approaches that public health specifically uses across jurisdictions, whether we're talking about counties and cities or states, and even at the federal level. We use these frameworks, these approaches and capabilities to help guide what we do so that everyone is focusing on the same kind of aspects of preparedness and response. So the top kind of boxes that you see on that slide are representative of the public health emergency preparedness capabilities, or FEP capabilities. We use these to help create that foundational approach to ensuring that we're addressing the main tasks that we need to have a jurisdiction that's prepared to respond to disasters from a public health perspective. And then, as you'll see, as we talk about in a little bit, we're constantly learning and improving what we're doing. And so we recently added in the public health response readiness framework to help us take those capabilities and show how we can have excellence in some of those kind of broader areas from what we learned about with COVID and some other more recent responses as well. As an example for that, it has a pretty significant focus on things like workforce development and workforce preparedness. And so all of those things are represented in the capabilities. That gives us the foundation. And then the response framework helps to demonstrate how we can show excellence when we have a response operation in place. The thing that you should take from this, right, is not necessarily learning all of the very specifics about what we do, but know that we use a framework across jurisdictions, so that Philadelphia is using this same foundational approach for their preparedness efforts as Bucks County, as Montgomery County, as San Diego, right? We're all using that same foundational approach. And the other thing that I think is important to highlight from these capabilities and the framework is that you see a heavy integration of utilizing partnerships and collaboration, that we don't do any of this alone, because again, we need a lot of response agencies and a lot of jurisdictions to work together when there's a disaster or severe weather. And you can see community is one of those partnerships and collaborations that's so important to any type of disaster response. And so how do we take that planning and then do something with it, right? On the next slide, you'll see what's called the phases of emergency management, where in the mitigation and preparedness phase is where we're taking steps to ensure that either a hazard no longer exists, or if a hazard does occur, that the impacts of it will be less severe. So that's improving our infrastructure, improving our education, conducting assessments to see where we're most vulnerable and kind of take steps to reduce that vulnerability. The preparedness part is where we develop those plans that address the capabilities and framework that I was just talking about. We test those plans, we prepare our workforce and our volunteers by training them on what the plan is asking them to do and make sure they have the skills and resources they need, and also educating the community on what those plans are and what we hope they'll do in terms of actions that they would take during a disaster. So that when we get to that response phase, meaning an event has actually happened, there was a severe weather event or some other disaster, we're going to implement those plans. We're going to take those life-saving actions, the actions to help preserve property, to respond and provide healthcare, medical care, and other resources, so that we can then move into this recovery piece where we're trying to not only get back to either normal, or some people call a new normal, however you want to frame it, but we're also trying to repair things that were damaged or destroyed. We're trying to then also gather information on the lessons that we learned. What went well with our response? What could we have done better in the future? And we start that cycle again. We start those phases again, where now we do new mitigation based on what we learned. We do new preparedness efforts, update our existing plans to represent new processes based on what we learned from that response and recovery effort. So we have those phases, and we do those all the time. Every time an event happens, we go through those phases, right? But when we do a disaster response, you'll see on the next slide, is that all of these phases occur at the most local level to start, right? And so every disaster response, while every level of government takes those steps to plan with that framework, those capabilities, they use those stages of emergency management, any disaster response starts at the most local level. And that might be a municipality, which is like a township or a borough kind of thing, or it could be a county or a city level. In order for the response to kind of move up in those levels of government, the lower one has to ask for help. And so if a county needs more resources, they then have to look to their partners in the region or maybe up to the state and say, hey, we really need some additional support and help. And that's how the disaster response kind of scales up in terms of level of government and resources. And that's built into our legislative framework as to how that functions as well. And so when we think about a disaster, and we can go to the next slide, knowing that the response starts at the most local level possible, a disaster in and of itself, by definition, is an event that happens that is overwhelming the local resources that we have. So you can see an emergency over here in that diagram on the left side is where our resources are challenged, but we're still capable of responding to it. We don't need extra assistance. A disaster and then a catastrophe, which is completely overwhelming, take situations where we no longer have all of the resources we need to properly respond to that event, which means we have limited resources. And so we need to not only figure out how are we going to use what we have in the most effective way, but how are we going to get more stuff, right, in the event of a disaster. On the next slide, we then start to think about how are we planning for having these limited resources, because that is part of what a disaster is, of not having enough resources to respond to the event. And so we plan for things like first identifying what our local capacity and resources are as a baseline. What are we most at risk for, and what are our hazards? And we already talked about some of those for Bucks County. And then assessing our vulnerabilities within our jurisdiction. Are there certain characteristics of our communities that make them more vulnerable or less vulnerable in different disaster types? Where are our buildings that are most at risk, our infrastructure, our critical resources, to help identify where we might need to provide more resources? And this varies by disaster type. And amongst all of that, we also have what we call priority discussions, where we talk about what things are we going to consider when we need to allocate resources to certain people or certain parts of our jurisdiction when we don't have enough. What characteristics are going to be most important for each disaster type? On the next slide, we then talk about, okay, we have these limited resources. Until we can get more, what are we going to consider when we have to prioritize and allocate those limited resources? And how we do that will vary from disaster to disaster, but we'll consider things like, what were the actual characteristics of a disaster, right? A winter storm or an ice storm is very different from a tornado, right? And how it impacts the people, how it impacts the county, where is the need going to be greatest, where are the populations most vulnerable, or our infrastructure that's most critical needs to be protected. Are there logistical concerns in that? Are there potentially areas of the county where it's going to be really, really challenging to get resources to them versus other areas that might be logistically a little easier, or they have the capacity to kind of take care of those resources once they get there and kind of disseminate them as needed? And we also look at agency guidance that we receive from state and federal agencies as to what things are really important to consider in that prioritization and allocation process. And then we also think about, when we're requesting other resources, when are they expected to get here? If it's going to be a long time, our prioritization would look very different than if it's going to arrive pretty quickly. On the next slide, then we say, okay, we're trying to figure out how we're prioritizing the resources that we have and how we're allocating those limited resources, but how are we going to get more so that we can supplement all of that? We do that through a couple of different approaches. The first is mutual aid, which is essentially agreements to share stuff across jurisdictions or with other agencies and organizations. We can request things from the state and federal level of government. A lot of that connects to disaster declarations. But then we also heavily connect to community resources, because again, that stuff is local to us. It'll be more accessible. It'll be more tailored to our local community. And that can take a lot of different forms. And on the next slide, it shows why it's so important to have these community level resources available to us. Getting resources from other jurisdictions, whether they're local to us or we're talking about state and federal resources, they take time to get to us. And so having things that are within our local community will help us get those resources a lot quicker. But we have to have them in an organized way in order to be able to logistically process and utilize them in an effective and appropriate manner. Community resources can include a lot of different things. We can think of the normal stuff of equipment, supplies, using local venues, other logistical support. It can include personnel in the form of staff or volunteers, whether they're part of an organized group or maybe they're part of a company that wants to donate some time of their personnel, right? It can also include things like relationships and local knowledge, which are inherently really critical to having effective responses in any local community. But I want to take the time to focus then on this personnel piece, because we will never have enough people to help us to respond to some of those bigger disasters. And so having community volunteers that are part of a trained, organized group that can quickly integrate into the structure that we've already established, right? That all hazards approach with that command structure that we teach all of our responders about. Having volunteers knowledgeable and trained in those things is inherently important to having a more effective integration of those community level resources. And so I will kind of conclude with that, and we will then start to learn a little bit more about that community importance.
Thank you, Dr. Redington, providing some context regarding extreme weather events and associated preparedness efforts at the county level. Fallon will now discuss how preparedness can transform disaster outcomes.
Thank you, Dr. Clem. We've heard a lot about extreme weather events and how to plan for them, but let's talk now about putting it into action at the community level. As previously noted, emergency and disaster responses start at the local level, where they're initially managed by local authorities. There's always a local component to emergencies and disaster, which is why it's important that all citizens, not just first responders, learn how to prepare for and respond to a variety of different emergency situations. You should always remember that you may very likely be the help until help arrives. Untrained bystanders who try to assist with mitigation efforts are well intentioned, but potentially endanger response efforts and may end up being part of the problem or even exacerbating it. So, even though we do want people to help, we also want them to be trained to know how to do that safely. So, this is why it's important that we use what we call blue sky days to learn how to safely support our communities in times of disaster. So, you may not be familiar with what a blue sky day is. A blue sky day is today, it's a normal routine day. Just the normal things are going on in our community. A black sky day is one with a catastrophic event or events. Blue sky days are optimal for taking the necessary steps to develop the knowledge and skills that are needed to support your community on black sky days. Joining a volunteer organization that focuses on emergency preparedness and response is a great melding of community engagement and climate adaptation, which Dr. Clem discussed earlier. So here we have volunteer organizations, the intersection of community engagement and climate adaptation. So we're very fortunate that in the United States, there are many different volunteer organizations that focus on emergency and disaster response. Those include what's listed before you, and additionally, groups that focus on rebuilding homes after disasters, those that provide legal services, behavioral and mental health care, feeding communities and first responders, long-term recovery, and so much more. Within these organizations, they may need those who are savvy with social media, who can serve as translators, and those with strong organizational skills or even logistical experience. Many organizations need a variety of backgrounds to support their efforts. So with these many options and opportunities, it's important to take time to research them to find the one that's right for you. And that's what you need to do on these blue sky days. So keep in mind the amount of time you can commit to volunteering, as there may be a minimum that has to be met. Learn the mission of the organization and make sure it aligns with your interests, your values. Make sure that the work that they do is accessible for you and works with your lifestyle. If you cannot easily find information about a volunteer response organization, contact them for additional details. Many of them will put a certain amount of information on their websites or in their social media. But if you want deeper understanding, reach out to their coordinators, ask if you can come to a meeting, maybe even speak with one of their volunteers to do sort of a peer-to-peer discussion about what it's like to be a volunteer in that group. So volunteer disaster response organizations often serve as a critical link between the community and government, improving services to the whole area. Sometimes that link breaks down, and these organizations help bridge that gap so that the community is still served and the government is also liaised with. These types of organizations strengthen community engagement and resilience. They pre-vet their volunteers, which is a critical part of these organizations and a critical function. We don't want people just showing up saying, I'm a doctor and I'm here to help. We have no way of knowing if you are a medical doctor, a PhD, if you have any of those. We don't know your background, if you were convicted of crimes that might make you ineligible to help at community events. So we always like to use these blue sky days to pre-vet our volunteers to make sure the people that are going out have the skills and are also safe to engage with our communities. And also these organizations understand the unique needs of the community. Every community is different. So what works for Bucks County or even Yardley in Bucks County isn't necessarily what's going to work for the state of California or the city of Pasadena in California. So that's why we organize usually locally to better understand those needs. So, what are the benefits of being affiliated with a disaster organization? Let's talk about it. So, many of these groups will provide training and skills, and they will do so through a qualified staff member, or they may even contract out. But somebody who's qualified will provide it versus, your friend next door who maybe learned how to do a certain skill and tries to recreate it. If they weren't trained in a way to be a trainer, it may not be as effective. So you get those skills and trainings. You are pre-vetted and pre-credentialed, which means that when you want to help support disaster responses, all of that legwork's already been done. So you won't be necessarily turned away as long as you're on a deployment that's approved. People already know your background, the skills that you bring, and somebody might reach out to you and say, for this event, we need people who are social media savvy, and they already know that that's you. So they reach out to you directly. It really does help in the long run to have all that affiliation. You get access to information and resources. Our volunteers usually hear about public health concerns, disaster concerns, resources that are available before we even share that with the broader community. We always want to make sure our volunteers are up to date on the information that we know. And also it improves personal and community resilience. So you as a community member become more resilient, which also then in turn strengthens your community. And usually the people in your community are trusted by the general public. These aren't strangers coming to town telling you what to do. It's you helping your neighbors helping you. So it's very local, and you may see a lot of familiar faces because of that. So there's many different things that you could do on your own as an individual or a family to support the community in disaster. You could do all of that, but doing it through an organization and being affiliated and getting those trainings, the background checks, all of that will make you a much more critical asset. So we've talked broadly about community engagement and volunteering. Let's look at a specific organization, the Medical Reserve Corps. We are going to talk more about the unit that I oversee, which is the Bucks County Medical Reserve Corps, or BCMRC. But first, let's talk about MRC at a national level, because it is not, unfortunately, well known by everyone. So Medical Reserve Corps were created in the aftermath of the September 11th attacks, when there were many untrained and unaffiliated citizens who wanted to support response efforts, but either didn't know how or tried to do so in a way that wasn't safe or in alignment with what first responders were doing. Each of these units, and there's almost 800 of them across the US and our territories, they're organized locally so that they can best meet the needs of the communities. And each unit has its own processes, their protocols, activities, missions. There's a unit, I believe, in Southwest US, where all of their members are acupuncturists, and they provide acupuncture to first responders during disasters to help with relaxation, stress, things like that. And that's what that community needed. So it's always critical to look at what the needs are of the community and how these groups are meeting them. So in Pennsylvania, we have 10 Medical Reserve Corps units. There are 2 on the west side. We have Erie and Allegheny counties. In the middle, South Central. And then on the East Coast, we have the glut of them. There are 7 in total, 1 in Bethlehem, 1 in Allentown, and then the other 5 are in southeastern PA. So we are going to focus on Bucks County MRC in the Southeast for the purposes of this presentation. Our unit has about 400 volunteers of all different professional backgrounds, non-medical, and healthcare providers. Our greatest number of volunteers are non-medical and registered nurses, but we also have dentists and veterinarians, physician assistants, nurse practitioners. We've got a whole different variety of people who all bring their skills to support our community. These 4 categories create the framework for our unit's approach to our volunteer readiness, transforming them from potential bystanders to assets in our community. And while the slide title says preparing to weather disasters, this is how we do all hazards planning, not just weather. So looking at it specifically, on this slide are examples of how we prepare the volunteers to weather those disasters. And this is just a small snapshot, but you can see with the training, we do an introduction to disaster preparedness, which creates a foundation on all different types of emergencies and disasters, including tornadoes, hurricanes, thunderstorms, flooding, nuclear, all of those different things so that people will be ready, even fires, and how to make a fire resilient property. We also provide CPR, first aid, and AED. We have an entire training series on behavioral health impacts, including the impacts of climate change and also pandemic deployment stress. We offer all of that because we know our volunteers not only may encounter that stress in the citizens that they serve, but also as responders. So we want to make sure that we're giving our responders the tools to prepare for that and know how to respond. And then also points of dispensing, because we may end up dispensing medications, vaccines, antivirals. We could be dispensing water or blankets, and we practice all of that through our trainings and exercises. We also do partner engagement and outreach and education. And the outreach and education component is really, really great, I think, because our volunteers not only are giving tools to their community members, their neighbors, on how to strengthen their resilience, they're also teaching it. And they always say, you don't really understand something until you can teach it. And that's how we also make sure our volunteers can reinforce their knowledge. So for weather emergencies in Bucks County, we, like many communities in the Southeast, are often impacted by severe weather, including flooding, tornadoes, and extreme heat. Our volunteers have supported weather-related local responses, including a multi-agency resource center that was established in Lower Bucks after historic flooding, and cooling centers. And we provide the resources and education about preparedness for the all hazards, as discussed before. And we keep doing activities to ensure deployment readiness. And as Dr. Redington previously shared, weather events in Bucks County, they've increased over the past 2 decades and will continue to do so. And that's why we continue to make sure our volunteers have that deployment readiness. So if you've been waiting to act on learning how to be better prepared, how to help your community, the time is now. You are watching this on a blue sky day, and someday it might be a black sky day. And if you haven't acted beforehand and you want to support your community, you really may not know how, or they may not allow it, because in the disaster, they're not necessarily going to have time to do your background check your skills and credentials, make sure you are a licensed healthcare provider if that's your background. They will not necessarily have that time. So the time to act is now, because those climate disasters will continue to occur and they will increase in both frequency and strength. And it's important that we do what we can now to learn how to best support ourselves, our neighbors, and our communities in the future. And I say this to you not only as a coordinator of an MRC unit, I'm also a volunteer in the community where I live. And I know how critical it's been for me to have that information and skill set and to be able to take care of my community when I'm not in work status. So if you're looking to join a volunteer group and you're not sure where to start, you can look at the National Voluntary Organizations Active in Disaster website. That is, as the name alludes to, a national site. So if you don't live in Pennsylvania, or you are moving out of the area and you want to look at all the different organizations like this, you can go to their website. If you live and work in Pennsylvania and you are more interested in something local to you now, you can go to the Pennsylvania one. But this is what's going to help you transform from bystander to asset.
Thank you so much, Fallon. We really appreciated that perspective. And I'll also share that, I'm also an MRC member of Bucks County, which is how I connected with Fallon as well. So thank you for sharing that important perspective. Now we'll hear from Amy Dailey, a longstanding MRC program volunteer from our local community here in Bucks County. Amy will share her lived preparedness experience by talking about how being involved in the MRC has impacted her professional and personal level of preparedness.
Hello, everyone. My name is Amy Dailey. I'm a registered nurse, and I've been a Bucks County Medical Reserve Corps volunteer since 2006. I have my master's degree in public health nursing and administration. I completed that in 2010, and I actually, my interest in completing that degree was triggered by my trainings and my volunteer experience with the MRC. So I kind of was bitten by the public health bug, and that really kind of launched my interest and kind of guided my nursing career up until even now. I've been deployed throughout the years in extreme weather events, as well as participating in drills, vaccine clinics, did some education sessions with the MRC, community outreach, and of course, pandemic response has been a part of it as well. I think throughout my training, as I built on my training, and certainly it impacted my professional career in that I utilized a lot of that experience towards my roles as a nurse at a local theme park, as well as it kind of propelled into, I served as the health services manager for the theme park, and then eventually took that occupational health and public health and safety experience and used that in my role as a regional director for employee health and safety at a local health system. So throughout my trainings, I really was able to apply that to my personal and professional life. And I still do that in a school nursing role as well. The training that I received initially, it was just kind of laid that foundation for what I could expect as a community volunteer. While I served in my medical volunteer role, I also supported non-medical functions and learned a lot about operations and logistics along the way. I think from a personal perspective, not only my community benefited, my neighbors, start with our small community, but my family itself. We started having conversations right away when I was doing my training just about what my role could look like, what I might be walking into or participating in, even from the drill perspective to actual deployments for needs in the community. So I really wanted feedback from my family to make sure they were confident in what I was doing and I wasn't adding stress to them. And then, of course, from my employer side, I kind of wanted them to know I was involved so that if I were to ask for time off, depending on how my schedule was at the time, I would kind of know, was I getting paid, not getting paid? So just with those initial trainings, it helps you to kind of look at the bigger picture of how my family's going to be impacted, how my job can be impacted, because we all have, a big heart when we're going into this. But really, we have to think about all of the other perspectives and things that might impact it as well. So once we kind of had those conversations, I felt more and more prepared as time went on. But I would have to say my biggest impact personally was during Superstorm Sandy. I was deployed to a shelter in the area, and unfortunately, Lower Bucks County was hit really hard. And a lot of my family, friends, community members, neighbors were without power, damage to their homes, and in need as well. So really, once we got that call that we were being activated, I kind of tapped into my prior training. I have my little notebooks. I still have them. What are those initial steps? And those initial steps were to make sure my family was okay, make sure I checked on, some of my close family members to see where they were and make sure they had what they needed. And then we pretty much packed up a bag and grabbed my bag. And that was the time that I realized I needed more bags because my daughter had to go one space. My husband had to go to work. We also had a dog. So we managed to patch up and make some additional bags. But after that, we had once we got through that Sandy, we created bags for each of us and checked them often throughout the year as things changed. But those particular resources helped me to be able to go to the shelter. And I think I go back to this being a really emotional deployment because it was within my own community. So when I was going to that shelter, I was seeing folks in their most vulnerable state, and these were some of them my neighbors, my coworkers. There were just a lot of familiar faces, which was difficult to remain calm, to not be upset and want to be there for them. But also, most of them recognized me first, and that was one of my main goals because I wanted them to be able to remain anonymous and maintain their confidentiality while they were there. So that's some different pieces of volunteering in your own community that I think we were definitely well prepared for, but until you experience it, without having that formal training, I think I would have had a lot more difficulty knowing how to react to being with my neighbors and some of my coworkers that I saw. So within the shelter, I was there as a medical, in a medical support role, and there were folks that we were helping to organize, getting medications and using a lot of different resources, but also there just to be supportive and help them get just basics if they needed clothing, helping really rally like our community to see what we had at our homes or maybe our employers that we could bring back to help the community. And one of the things that I had really kind of remembered from our bag with packing for my daughter, who was a teenager at the time, was the need for some things that you wouldn't think of are essential items, but they are. Maybe a deck of cards, a jump rope, things to just help make a little bit of stress relief, fun. Color. We did a lot of coloring, all ages. We did some coloring, and just having that knowledge of comforting and knowing how to logistically, even just how we were setting up beds and all of that training, we were able to make a medical area where the nurses that happened to be doing shifts, things were standardized a little bit, and we followed our guidelines, our incident command, and who we had to talk to, because we did that through through our medical lead at the time, and things like that. So definitely, volunteering during those events can be really challenging, but also having that training just helped our community be so much more resilient and prepared, I think, for how we handled that and how we were all deployed, and just the resources getting to the right community members, whether it was food or water, medication. Everybody kind of pulled together in a real formalized way, so we were able to make sure folks weren't falling through the cracks for their needs. And I think another piece of it that was so important through our psychological first aid training that we get helped us to develop a coping strategy for that particular event. So I connected with another member of the MRC, and we actually happened to be on similar shifts where I was relieving her. She was non-medical, but we had 10 minutes before she was coming on and I was leaving that we connected, and then I did the same for her. And I think that helped to just debrief the feelings that we had. So when we went home, we could be strong and calm and think logistically about what our family needed at home, because we were also trying to solve those problems without having power and damage or broken windows and things like that. So I will say, and I do get choked up a little bit sometimes, but the MRC has given so much to me personally, professionally, and to see how it has helped our community during times of need, like storms and pandemics and, the ice storms, just the education that we provide. It's just a really valuable organization. And I know, just really grateful to be a part of it. No one realizes their value until they take one of the trainings. So even for folks, I would encourage anybody to just look for your local MRC and sign up for a training initially, because everyone has something that they can help, and they're an expert in. Whether it's organizing things, helping. We had folks that were great at helping put together bags of clothing and sizes, and they could organize and logistics, for supplies. And then we have the medical support. But even from a medical support perspective, there are folks that have maybe a community background. There are folks that have a hospital background. We had folks in the shelter at that time that needed some pretty acute medical care that were with us, that just because of the timing, they had to be with us. So I think I would encourage folks to be a part of it, because they absolutely have some value to provide, and without them, we won't be able to help our community be resilient and prepared for the next event that happens, whether it's weather related or pandemic wise. And it helps to build that resiliency for their family, and it will spill over into their neighborhood and their community too.
Thank you so much, Amy. I really appreciate that perspective, and Dr. Redington for arranging that conversation. So in closing, I'd like to thank our speakers for their time providing such timely and invaluable perspective on the importance of taking a community-engaged approach to extreme weather or disaster preparedness at our local level. Preparing for and addressing climate change and extreme weather is very much aligned with the essential services that public health practitioners provide. For instance, in the assessment domain, as we see in this figure here, one of our services is to investigate and address health hazards like extreme weather. Further, stronger communities can weather disasters more effectively. In the policy development domain, for instance, another essential service is to strengthen, support, and mobilize communities and partnerships. So this is really key as we work together to protect and promote the health of all people in all communities. So we encourage you to get involved in preparedness efforts in your local community. Here are the sources we referred to during this talk, and some supplemental readings if you're interested in learning more about this topic. Thank you for joining us today, and thank you for watching.
I would like to acknowledge Adrienne Wood, who edited and produced the webinars, and all of the webinar organizers shown on this slide, who curated webinars on a variety of climate change and health topics. We invite you to follow this QR code to the College of Physicians YouTube page, where you can access the webinar series. The QR code on the bottom right will take you to the section on public health and preventive medicine. We hope you will consider joining this section to learn more about public health and activities to improve it in the Philadelphia region. Thank you for your interest in our webinar series on climate change and health in Philadelphia.